Hello. I am a 28-year-old mother of two. I am bored with my life and it is no fun. I have learned so much about medicine by watching shows like House, Grey's Anatomy, ER, Chicago Hope, Scrubs, Doogie Howser, Nip Tuck, and Nurse Jackie. I want to become a doctor so I can do all the cool things they do in the shows I watch on TV. Since I was so interested in medicine, my friend suggested I talk to a real-life doctor to set me on the path of becoming a real-life doctor.
Okay, I am a fourth-year surgical resident at Northwest St. Teresa Central Hospital of the Blessed Holy Crock Whore. What would you like to know?
Well, I see on TV that all the surgical residents arrive to the hospital between 8 and 10 in the morning. Sometimes I have to take my kid to school and want to get a manicure after. Is it okay if I come to the hospital a little after 10 in the morning some days?
10 a.m. My day is half over at 10 a.m. We get up every day at 3 a.m., get to the hospital at 4 a.m. That is if I am not on call and in the hospital overnight, and get no sleep. There is no resident that comes to work at 10 a.m.
Oh, okay. Well, I like it when the doctors have a tough case and must do many tests and spend many hours in the lab doing the blood tests on the fancy equipment. What equipment will I be able to work with?
We do not do any tests. All blood tests are done by some $10 an hour lackey in the basement. If they can't do them, they go off-site where some Indian guy with an expired J-1 visa does them.
Oh, that is unfortunate. Well, how about when the ambulances come with the people in car accidents? Don't you love rushing to the ER to save their life?
I do not take people out of the ambulance. The only time I go to the ER is for a consult on abdominal pain, and that is only when the lazy ER resident has not run any tests and just wants me to do their job for them.
Okay, so no ER. Well, I really like the family atmosphere portrayed on the shows. Everyone goes to the bar at 5 p.m. and has 10 beers, enjoys everyone's company, never gets hungover, and comes back the next day all ready to work.
5 p.m. Are you crazy? We never leave until 9 p.m. Then we go straight home. I don't hang out with anyone here. They are all tools. All the guys are dicks and all the women are bitches. So I go straight home, shove a piece of bread with peanut butter in my mouth, pass out, just so I can wake up 3 hours later and do it all over again. The only guys who drink here are the 50-year-old anesthesiologists. They are always drunk in surgery because they are so bored. One time in surgery, I looked over at one and he died out of boredom. He had completed every crossword known to man, including ones in Chinese. After all that, he just lost the will to live. So the anesthesiologists that survive must do so on alcohol to save themselves from spontaneous death from boredom.
Oh, okay. I guess I don't want to become an anesthesiologist. What about dermatologists? They look like they have fun, always saving people from skin cancer.
Are you retarded? All they do is pop pimples and give Botox to 60-year-old women who think they can go out and bag a 30-year-old man again. And if they get a huge pimple like the size of my left testicle, they send the patient to us anyway for surgical drainage. They are worthless.
Oh, okay. Well, ER was a great show. Maybe I can work in the ER bringing people back to life that had their heart stop.
The ER? Are you fucking mad? All you do is send heroin addicts to the methadone clinic and give antibiotics to mothers who bring their kids in for a cold and were not smart enough to take their child to the family doctor during business hours.
Okay, well, how about the internal medicine people? They look smart on TV.
I would kill myself if I was in internal medicine. All they do is walk around all day rounding and talking about a possible diagnosis for a 1 in a million chance disease about the diabetic patient with a heart condition who needs to lose 50 pounds and stop eating Krispy Kremes.
Well, is there anything good about medicine?
Absolutely not. In fact, I would go to the 10th floor and open the window and jump. But being at the hospital, they would just fix me and I would be back to work again next week, except with 1,000 broken bones. It is pointless. So I will just continue on banging my head against the wall every chance I get until the nurses convince the public they are capable of playing the role of doctor, and then I will truly become useless.